Hi, welcome to Leadership at the Forefront of COVID. I'm Dr. Ann Pendo, the Senior Medical Director for Experience of Caring at Intermountain Healthcare. And today I'm excited to have time to sit down with Dr. Bert Lopansri, the Associate Medical Director of the Infectious Disease Program at Intermountain Healthcare, as well as the Medical Director of the Microbiology Lab. So happy to have you here, Bert.
Thank you very much. Thanks for the opportunity to share myself.
Absolutely. What are you doing now? How did you know this was going to be as big as it was? So let's start there.
Yeah, so early on, when the epidemic was just getting started and was still localized, we got together as a team, and we watched this as it slowly unfold, and we organized internally about how to best meet the needs locally and develop strategies as the epidemic and then subsequently pandemic was expanding. And it quickly became apparent that we were not where we should have been. We've gone through SARS, we've gone through MERS, we've gone through many other epidemics and pandemics, but early on, it quickly became apparent that we're not meeting the needs with respect to diagnostic testing. It was interesting that when we were fielding those phone calls early on, the only lab that was testing for COVID was the CDC. And it was sort of frustrating to us when we would field these calls. Person just got off the phone from Italy and had respiratory tract infection, but they weren't admitted to the hospital, so they couldn't be tested. So it became apparent that it was going to get pretty big. And so we had to divide lanes for each one of us to step into and help guide our responses as the circumstances changed. And given my lab role, I was heavily involved with coming up with lab strategies and coordinating with other key stakeholders in developing criteria and how to implement these criteria. And it took a couple of months, but once the FDA cleared lightened their EUA regulations and their EUA rules, the lab jumped into action. And step one was get a test up and running as soon as possible. And we went with the CDC test and brought that from beginning to testing patients within 2 weeks. We had a test up and running.
How long would that typically take?
That would typically take at least 3 months.
Okay.
We went, the lab team is just an amazing group of individuals, and they jumped into action and had this test up and running quickly.
One of the things that has struck me so much in listening to you talk about your work is that sense of urgency, the creating criteria for testing, thinking about how we do supplies, what tests should we do. It seemed really overwhelmingly large. Yeah. And tell us a little bit about how you in your mind organized the work so that you could be effective in all those different ways.
Yeah, so having building relationships, cultivating existing relationships and building new relationships with incredibly talented people was the biggest piece of all of this. This got too big for 1, 2, 3, or 4 people, so we had to forge relationships with different teams and rely on other people's expertise to not only develop these in very innovative ways and implement them in very innovative ways. So relying on each other, relying on new relationships, and taking advantage of the strengths of those within the team was pretty much the keys to allow our response to get to where it needed to be.
As you think about your leadership, were there skills or things that you did that you leaned on from your prior role to be effective in this new, quickly moving role?
Yeah, so that's a great question. I think one of the most important things is just this fascination with germs, and over the past 9 years since I've been with Intermountain, just learning the ins and outs of not just how the organization works, but how the computer systems work, how the different parts of the lab work, all the ins and outs of everything from the ordering to the actual testing, and also understanding and getting a deeper understanding of how the molecular lab works. I think all of that it was heavily important in being able to keep things moving forward. So it was just accumulation of experiences since my first day at Intermountain.
Okay, so that's a good, I think, takeaway as you are starting a new job, really understanding all the parts of the work. So because there may be a time where you're going to really rely on an understanding of multiple processes.
Correct. And understanding who has the expertise to get this piece accomplished, and who has the connection to find what we need for this particular aspect. And I think the other important piece of it was cultivating relationships with, and building existing relationships with outside entities. So we rely heavily on our interactions with the Department of Public Health, the Public Health Lab, and with ARUP. Early on, we forged this task force, and we worked together to solve all the seemingly daily problems that would arise with developing tests and scaling it to where we need to be.
So as our time comes to a close, which is, there's never enough time, tell us, or tell me, what have you learned about yourself as a person and yourself as a leader?
So as a person, I quickly realized that in order to be effective, you really have to take care of yourself. And I have this habit, my wife will be the first to tell you, of really diving into the work. So even though I'm home, I will continue to do what I need to do and try to keep things moving. And as a consequence, I sometimes neglect myself, and I haven't really, probably didn't build as many relationships with the family, or I tend to put those on the back burner. But this experience has really highlighted that need. With this pandemic has been difficult for all of us, but it's also been very difficult for people in the home. My children, my wife. It's been exceedingly difficult. They've gone from very active to suddenly everyone's at home doing schooling on a meeting and or whatnot. And I think that helped us connect better as a family. As the external activities faded, we were better connected as a family unit. And I personally have picked up new hobbies and health. I'm no good to anybody if I'm no good to myself. Yeah. So picking up new activities to better the physical health also helps with the adjusting to the challenges at hand.
Love that.
Yeah. And professionally, I think building these new relationships, my contact size has doubled. So it seems like every other day I'm adding a new contact. And so just many wonderful people, collaborating with many wonderful people, talented people in different work groups. So professionally, I've been able to connect more widely from north to south with people I've not met before. And we've been able to work together to solve different challenges that we face.
That's so great. I mean, I think as we think about lab work and microbiology, I probably would have focused more, or thought that your focus would be on the work. And so it's really lovely to hear you talk about the importance of relationships and connections that then allows you to be more effective. So I want to make sure that everyone can see your lab tie today.
This was a generous gift from Todd Vento early on in the pandemic.
You came well prepared.
Yeah.
Thanks so much for being with us today.
You're welcome. Thank you for the opportunity.
Absolutely. And thanks everyone for joining us on Leadership at the Forefront of COVID. We'll look forward to speaking with you next week. Take care.